We continue our video series about the shoulder joint. Last time we talked about the muscles that stabilize the scapula. The muscles that stabilize the clavicle, that's the serratus anterior muscle. The subclavius muscle, how to restore them on your own. Now, the next part of the exercise, but you should only move on to them after you've done the previous ones. You shouldn't start them until you've restored the subclavius muscle and the serratus anterior. That is, these first two muscles are restored first and foremost. So if you've already done this, then move on to the exercises I'm about to show you. It's absolutely necessary to restore the long extensor of the neck. This is the muscle that goes like this. We've already talked about it. It starts from the occipital bone and attaches to all the cervical vertebrae and to the thoracic vertebrae up to the sixth. And at the same time, you also need to restore the rhomboid muscle and the middle and lower trapezius, but the rhomboid muscle is more important here. That's it. So how do you activate and get the long neck extensor working? First, do a little self-diagnosis. Stand in front of a mirror. And do this simple test. So, you stand in front of the mirror and tilt your head back. If your neck muscles are working properly, this movement will be symmetrical. That is, you'll do it along a straight line. If there's any imbalance in the neck muscles, and it doesn't have to be the long neck extensor, it could be different lengths of the scalene muscles, or maybe the sternocleidomastoid muscle isn't working. But if you've done the previous exercises, then most likely the problem will be specifically in the neck extensor. So, you stand in front of a mirror and do this kind of movement. Normally, it should be symmetrical. If it turns out to the side like this, it may indicate that the tone of the neck extensor is different. Or there is some kind of fixation or subluxation of a vertebra that prevents you from making a symmetrical movement. But right now, we're talking about muscles. You can't correct vertebral displacement on your own. So, we're only talking about muscle problems, specifically the loss of muscle tone. This is the first test you do on your own, and the second, you do it yourself. And you grab this muscle like this with your hand. Then you compare the size of the muscle on one side and on the other side. Very often, this happens with shoulder problems and instability in the cervical spine. There is a difference in the size between these muscles. That is, on one side, the size may be bigger or even half as small as on the other side. And this already indicates that the extensor on the side, where the muscle is smaller, works worse or doesn't work at all compared to the other side. Next, start the exercise itself, which will restore the tone of these muscles. That is, just like we did with the previous muscles. First, you need to eliminate all the painful points at the attachment sites of the long neck extensor. And they are not located here, not in the cervical spine, but right here in the thoracic spine at the points where the muscle attaches to the thoracic vertebrae. To do this, there is a very effective exercise. For this, you will need a ball. Take a tennis ball. It's better to start with a tennis ball because it's softer, and then you can move on to firmer ones. Well, it will be enough to restore the muscle and then move on to tennis ball exercises. You place it like this near the spinous processes. And there are two options here. It's better to start the exercise near a wall first. So you stand next to the wall, and you have this ball between the wall and your thoracic spine. And now you make small movements, to one side, to the other side, to one side, to the other. You find a painful spot, and this way, you apply pressure to this trigger point with the ball when it's between the wall. Imagine my hand is the wall, and you make these movements to one side and the other. You can do the same thing lying down, meaning you lie down, place the ball under you, and work right up to this spot. All of this, the area where the long neck extensors attach. You do this on one side, then on the other side, you'll find painful spots, usually trigger points. They can basically be anywhere around here, but more often they're found up here at the top. You definitely need to work these out here because there are usually pretty big, painful knots in this area. You remove all of this in a mechanical way using this ball. And only after that do you move on to the exercises. To start, you begin with static exercises. It's very convenient to do this either lying down or sitting in a car, for example. So, for example, I have a headrest behind me, and with the back of my head, I press like this. The most important thing here is not to tilt your chin up during this movement. And if you notice that the muscle volume on your right and left sides is different, then do the exercise separately for the right and left muscles in turn. Focusing on the side where the muscle volume is smaller, do more repetitions, more sets. That is, this is for both sides at the same time. I do it, yes. I press against something behind me, like some kind of obstacle, or the headrest in a car. Or you can even do this lying on your back. So you lie on your back, put a small pillow under your head, and press. This works both extensors at once, and this one is for the left side. So for this, I need to turn my head so that my nose is pointing at about a 45-degree angle. And I do exactly the same movement backward. I press on something and do the same thing to the other side, like this. This is how to restore the neck extensor, the long neck extensor.